Okay, so there are 4 rotator cuff muscles. They are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Altogether, these muscles work together to pull the head of the humerus against the glenode cavity. So the first muscle is the supraspinatus, and this is a cylindrical muscle and it has horizontal striations. It has 2 attachment points. First, it immediately attaches to the supraspinous fossa of the scapula, which is right here. It's the top of the scapula. And it laterally attaches to the greater tubercle of the humerus, which is right here. The muscle action for the supraspinatus is abduction, and that is pulling the arm back towards your body. And this is the action for the supraspinatus because it moves the 2 attachment points, the top of the scapula and the greater tubercle of the humerus, closer together like this, and it also contracts the muscle. The second muscle in the rotator cuff is the infraspinatus, and this is a triangular muscle with diagonal striations. This also has 2 attachment points. It medially attaches to the infraspinous fossa of the scapula, which is the back of the scapula right here, and it laterally attaches to the greater tubercle of the humerus, just like the supraspinatus, which again is right here. The muscle action for the infraspinatus is lateral rotation, and lateral rotation looks like this. It's pulling away from the body like this laterally, and this is the muscle action for the infraspinatus because again it's bringing the 2 attachment points, the infraspinous fossa of the scapula and the greater tubercle of the humerus, closer together, and it's also contracting the muscle. The third muscle in the rotator cuff is the teres minor, and this is a flattened small triangular muscle, and this also has diagonal striations just like the infraspinatus. It has 2 attachment points. It medially attaches to the lateral border of the scapula, which is right here. It's on the outside of the scapula, and it laterally attaches to the greater tubercle of the humerus, which again is right here, and also where the supraspinatus and the infraspinatus attach laterally. The muscle action for the teres minor is lateral rotation, just like the infraspinatus. Again, that looks like this, and it's bringing the 2 attachment points closer together. So it's bringing this lateral border of the scapula closer to the greater tubercle of the humerus, like this. For the teres minor, it also has a second action, which would be adduction. And adduction is moving the arm back toward the body, and this again is bringing the 2 attachment points closer together. So it's bringing the lateral border of the scapula closer to the greater tubercle of the humerus. And lastly, the subscapularis is the 4th muscle in the rotator cuff, and it is a flat triangular muscle that also has diagonal striations just like the teres minor and the infraspinatus. It has 2 attachment points. It medially attaches to the subscapular fossa, which is the inside of the scapula. It's the reverse of the infraspinous fossa of the scapula, so it's the inside. And it laterally attaches to the lesser tubercle of the humerus, which is here. And the muscle action for the subscapularis is medial rotation, so that would be bringing your arm back this way. So it's bringing this inside portion of the scapula closer to the lesser tubercle of the humerus. So that's why that's the muscle action for the subscapularis, and it's also bringing the muscle fibers to contract. So those are the 4 rotator cuff muscles and their attachment points and their actions.